All right, you
Lisa,
comfy there?
I'm very comfy. I can't like either I'm in front of it or it's not. Like, what do I do?
Just move closer to the fire. People may be concerned eventually.
All right,
Okay,
you ready?
I'm ready. Welcome to a special edition of Sisterhood of the Scalpel.
Okay, this is getting intimate with the Sisterhood of the Scalpel. And we're in our PJs and we're at
Mm.
home with our fireplaces. I really
10
like yours.
hours, 10 hours continuous fireplace with sound effects.
I might actually get set on fire here tonight. So I might have to turn mine down a little bit.
Mm.
But we wanted to talk about some intimate stuff.
Yeah.
And we wanted to talk about intimate surgery and have a moment to just stop, girls to girls, quiet, coffee, rosé, champagne, whatever it is you're drinking, and just talk about down there. Why don't we talk about it? Like, is
Can we
that
just
my generation, or do you guys not talk about it either?
I mean, I think we talk about it more openly, but it's so funny. Why are we saying down there? Let's just talk about it. We're talking about our intimate areas. We're talking about our vaginas. We're talking about our labias. We're talking about our mons areas. We're talking about the clitoris. Let's just say it. Clitoris. Sounds good.
Release it. No, and you know what? It's funny because I think I have a group of friends that have these insane type of conversations all the time, but
Hmm.
I don't think every girl does. And
Hmm.
it's almost like we've been embarrassed to talk about our anatomy. So we're going to start. Dr. Z, show us the anatomy. So
Ta-da!
wait a minute.
Hey!
Oh, that's the meme I sent to Dr. Z that said, and 99% of men can't find the zipper. So it doesn't look that inaccurate. It is a
It's true.
purse. We don't know if it's designer, but that is not a bad representation. Okay, give us the real stuff.
All right, this is what our real anatomy looks like. And you know what? We don't always get to see our own anatomy at the very least from this point of view. Because let's be honest, unless you're pretty good at doing your yoga, your contortions, it's a little bit hard to take a look down there and see things properly, even if you're holding a good mirror. But it's important to talk about what our anatomy is. Let's get the vocabulary straight here. Okay. So first, we have the area which is just in front of our perineal region. This is the mons area. It sort of is the medial area. It's what we see when we're standing upright most commonly. Sometimes this area can be a little bit more poochy, a little bit fuller. Sometimes they can actually be hanging a little bit low if we've lost a lot of weight. So lots of ways to address all these concerns. And then when we move more right beneath between our legs, this is where the anatomy is a little bit more complicated, but definitely not difficult to figure out. So moving from the outside inwards, we have our labia majora. Now the labia majora is the outer portion of the lips. It's a little bit fuller. It's more flat, and that's an area that just gives sort of a more broad opening and protection to the more sensitive areas. The more sensitive areas are the areas that surround the opening to our urinary tract, the urethral opening, as well as the vagina. And that's surrounded by the labia minora, which is the thinner lips that sometimes can be a little bit larger and may require some treatment regarding that. And at the very top, more anterior portion of that is the clitoris. And that's the area where we get a lot of our sensations. That's sort of is a little bit of the pleasure there. So it's a very well respected anatomical area. And that area, because it's such a sensitive area, is actually surrounded by a little bit of more tissue covering, more skin covering that we refer to as the clitoral hood.
So I think the key here is that labia and the vulva, this whole area we call the vulva. The vulva is no different than noses. we get cute button noses and
Mm-hmm.
we get larger noses. There is no right and no wrong. And every day we say this to every patient who comes in.
Mm-hmm.
Do not let anyone, male or female, tell you you're right or you're wrong.
Mm-hmm.
There are variations of normal, and there is no right and wrong, and nobody needs surgery. And the only reason to need surgery is because it bothers you, or you're concerned about it, or it interferes with your day to day life. And if we look, I think we found a slide, Dr. Z, about like different shapes and sizes. Every one of these is normal.
When we're talking about it being an area of concern for our patients, it's when it's causing discomfort, right? If you're wearing tight clothing and in clothing you're getting pain, rashes, just not being able to comfortably sit, not being able to do a lot of your activities. So, for example, if you're an avid bike rider, horseback rider, things where there's a lot of pressure in the vulval area, and because of some of the tissue excess, it's causing you discomfort. That's the type of concerns that we're here to address. And sometimes it is about intimacy, right? It's not wrong for you to want to seek, um, surgery so that you're able to be intimate more comfortably, but it's supposed to be for you, not to appease anyone else from that perspective. And sometimes that is something that definitely can get addressed with surgical procedures because extra tissues can cause more friction, they can cause pain during intercourse. So there's a lot of components of that that can be helped, certainly.
What's the most common thing we do? We do labia minora corrections. So not the outside lips, the inside lips. Well, we do that under local. And the gynecologist referred to us to do this. And
Mm-hmm.
one of the things that's important is it is excessive tissue. And I'm surprised how young some of my patients have been. And it's been, I can't go out to a swimming pool because skin might hang past my bathing suit. Now,
Mm-hmm.
we make this easy. Local freezing, laughing gas. You don't want anyone to know, you can drive home. So it can be really quite simple. Doesn't have to be a pretty big production.
We can do any technique. It's really dependent on what your anatomy is and how we can best achieve that so that you get the best result. We strive here, we're very conservative when we do this because when we cut skin, it's hard to put skin back. But if we take off too much, we don't want to do that because things can get a little bit too sensitive. So that's something that we talk about too.
The ultimate goal is that a year from surgery, you forget it was ever a concern of yours. I think a lot of patients don't even know we can do this, and because we
Mm.
don't talk about it, and we're not open about it, and it's relatively easy with a really great impact.
Yeah. And if you're thinking about it, you're not alone. Like we're saying, we're doing this for sometimes very young patients who need it. Sometimes they're mothers, right? Motherhood changes your anatomy. Sometimes we need a little bit of help getting back to feeling more comfortable. And sometimes it's, again, active, someone who's active in sports, active lifestyle. It, our patients come from all stages of life. And again, there's a bit of a stigma attached to this surgery that doesn't need to be there.
And people think that it's all porn based, and it's totally not. There was an article
Mm-mm,
written that said porn was motivating patients to come in, and I'm like, that's not what my experience is in 25 years.
mm-mm,
But there's a lot we can do. So we can do labiaplasty surgery. We can do fat grafting. As we
mm-hmm,
age, especially with menopause, a lot of women lose the volume on the labia majora, the outer lips. So it looks very deflated. So we do a lot of fat grafting. We can even do filler, believe it or not.
mm-hmm.
The clitoral hood, the skin over the clitoris, sometimes need to be trimmed back. And sometimes the vault itself is a little too open. And even if the vulva, the entrance into the vagina feels a little bit too loose, we can do what's
Mm-hmm.
called a posterior vault repair and tighten the muscles. And it's not that dissimilar than what we do in a tummy tuck, where we're putting the muscles back after, some kid has stretched them out. Take this as birth control.
The technology that we really like in this area is called Votiva, and essentially is a non-invasive small wand that is inserted, and it helps stimulate the vagina to get more youthful, so we get a bit of tightening. We also get more moisture production, so it helps with dryness. And it's all based off of using radiofrequency technology. Now, this is something, again, sounds a little scarier than it is.
The biggest thing about Votiva or
Yeah.
radiofrequency in this area is that patients find more lubrication even after
Mhm.
menopause, where a lot of women find they're very dry. But the biggest factor is patients report increased sexual satisfaction. Now, please note, we did not ask, and forgive me, or care if their partners saw an improvement, but the women reported an improvement. And that's important to me.
Hmm.
I think that's really important. I think we need to take ownership of our sexual satisfaction. So we also have ways to change the texture of the skin in that area. Things like Fractora, which is microneedling radiofrequency. We have creams
Yeah.
because some women feel it's too dark or it bothers them. Again, please don't do anything that's not for you. But you have the right to do anything for you. And no one else gets to say that that's right or wrong.
Hmm. Yeah.
I hope our little fireside chats have been helpful. And if you have any questions, you know what? This is girls talking to girls. And if you have a question, please don't hesitate to ask Dr. Zamani or I. We'd be happy to answer it. DM us on Sisterhood of the Scalpel, ICLS, whatever. We will get to your questions. We will answer them. We're committed to answering at least once a month everyone's questions. And we're here for you.